Welcome everybody. I'm so happy that you welcome me with that many warm cheers. I am your host Anton Green, and we are here today to celebrate our fifth anniversary of the Dental Talk Show. Now, with us today, we have a special crowd as well as special guests. Special crowd is comprised of oral healthcare providers, and these oral healthcare providers are special because they have retired early. And the reason why they have retired early is because each and every one of them has already experienced a musculoskeletal disorder. Now, today with me I have three special guests. One is a physiotherapist, and two of these special guests will be chosen from the crowd yourselves to talk about your musculoskeletal disorder. Now, the first guest that will be coming up today is our guest, this physiotherapist. Her name is Trishan Thompson, and the next time you see her, she will be up here right beside me. Now we're going to take a short break, and we'll be back after I take these messages. Welcome back, everybody. I know you guys are excited, but please make our guest feel welcome. Her name is Trishan Thompson, as I said before. Woo! Now we're going to make Trishan tell us a little bit more about musculoskeletal disorders. Trishan, take it away.
Okay. Musculoskeletal disorders. These are disorders of the muscles, tendons, vascular systems. They're not directly caused by instantaneous events or acute traumas.
So you can basically say that they're caused by prolonged movements, or they're stuff that happen over time, not instantaneous.
Yes.
Okay. So, for those of you guys who don't know, musculoskeletal disorders can be prevented, and yours could have been prevented if you had incorporated ergonomics in your dental office or in your dental profession, a practice that you were doing. Now, a little bit more about ergonomics. Ergonomics is a way of arranging your environment in a way that complements the work that you do. It allows you to work more effectively and efficiently, and it also allows you to stay away or keep away musculoskeletal disorders. So musculoskeletal disorders are the problem. Ergonomics is the solution. So our next guest, Miss Tamian, will be telling us about her life as a dental healthcare professional and a little bit about her past and how she ended up with these musculoskeletal disorders. I in turn will tell her what ergonomic practice she should have incorporated to have her still working her job right now. So the next time you see me, I will be with Miss Tamian. Miss Thompson, thank you for accompanying us here. I hope that we see you again soon, and I have a feeling that we'll see her again soon. She'll just have a different personality. Thank you so much.
Nice being here.
And there are refreshments waiting for you outside. Welcome back, everyone. I'm here with Tamian Robinson.
Hi.
And she is a early retired dental healthcare professional. Now, she's gonna tell us about the musculoskeletal disorder that she faced, but I think it's best for you guys to know that there are three categories that musculoskeletal disorders can fall into. We have back disorders, neck and shoulders, and hand and wrist disorders. Now, Miss Tamian, what kind of disorder do you have?
I suffer from neck and shoulder disorder. More specifically, thoracic outlet syndrome. That's what I suffer from.
So tell us about that disorder. What does it do? How does it affect you?
Alright, so I usually feel pain in my shoulder, my arms, and my hands. Yeah, so it affects me there.
But what do you think you do in your practice that could result in you having this disorder?
So I usually slouch over my patients, to be honest. So over time, it became a habit for me. So I think that's what contributed to that syndrome.
So let me let you in on a little secret. If you had incorporated ergonomics into your daily practices, then you would have been a lot better. You would have been better off. For example, if you had adjusted the patient's chair or the dental chair to your liking, and also in a manner that is comfortable to the patient, then you would have had a lot more years left in your practice.
Well, I guess that could work, but I just became so accustomed to, that position, and it became comfortable for me. So when I actually tried to position myself in such a way that it wouldn't affect me, it was uncomfortable for me.
I understand.
Right.
Alright, Ms. Tamian, you've helped so many persons out there understand that ergonomics is something as simple as adjusting their dental chair, and that it can help to add on some years on their practice. Our next guest, who is almost identical to the physiotherapist, she will be coming up here. Her name is Treshawn Thompson, and she is a dental healthcare provider, and she will tell us about her musculoskeletal disorders and how she and I will in turn enlighten her on how ergonomics could have helped her lengthen her years of practice. Please join me in thanking Miss Tammy Ann Robinson for joining us today, and welcome Miss Treshawn Thompson as she comes up on stage. Welcome back, everyone. We have our third guest of the night. Her name is Treshawn Thompson, and she is a dental healthcare provider. Treshawn is going to tell us about the musculoskeletal disorder that she faces. Tell us about that, Treshawn.
Well, unlucky as I am, I suffer from two. So I suffer from carpal tunnel syndrome. This is a disorder of the hand and wrist. I have numbness in my wrist and hand right about now, and I also suffer from a back disorder. So I have a lower back pain, and this radiates throughout my body, especially my legs.
Now, Treshawn, for your hand and wrist problem, you said carpal tunnel syndrome. I would suggest that it's because you used heavy vibrating hand pieces. If you had used lightweight hand pieces and lowered or decreased the amount of times that you use the vibrating hand piece, then you would have definitely put a lot of years on your practice. You would still be practicing now, and you will be in a lot less pain than you are in now. As well as your lower back pain, if you had used a dental chair and adjusted your posture and sat up straight, then you would have not been in this situation as we are speaking. Now, a prime example of what you have done would be something like this. Alright, so thank you everyone for coming out today. Thank you so much, Ms. Treshawn, for accompanying us on our 5th anniversary of this dental talk show.
It was my pleasure.
It's a pleasure to have you. The gentleman at the door will escort you to the refreshment room. I do hope that you have a good rest of your night, and thank you again for accompanying us.
It was my pleasure once again to be here.
Alright, thank you so much everyone again for coming out to the 5th anniversary of the Dental Talk Show. It's been a pleasure to have you. I am your host, Anthony Green, and I am very happy to say that this was a very successful event. Each person here, even though you have a musculoskeletal disorder, I trust that you have all gathered enough information to understand why is it that you have these musculoskeletal disorders and how you could have changed your history in a way that which you will be practicing even today. I'd like to also extend my gratitude to Ms. Cheryl Bingling, our chairman of this association, and the person who keeps us showing the Dental Talk Show. I'd like to give her my appreciation, as well as giving us, our group, this presentation to do and allowing us to have this opportunity. Now everyone, especially those of you in our class, if you can't tell, I'm breaking the fourth wall now. Those of you in our class who are watching this presentation, I hope that you have enjoyed it. I hope that you have learned from this talk show, and I can't wait to get to meet you guys next time on screen. Thank you so much, and we'll see you in class.